Today we're going to be talking about the Philips IntelliVue MX700 monitoring system that we use in our emergency department.
And I'll be showing you how to set up the monitor ready for use and how to change some of the parameters. Okay, so I'm going to show you how to switch the monitor on in the first place. We know we have power to it already because the green button is on, and then we're going to press the on-off switch. We just need to hold it for a couple of seconds for the machine to be activated. Just takes a few moments for the machine to go through some checks and then it'll be ready for use. Okay, so we've already got our patient attached to the monitor and we've already can see some settings on there. At the top here there are some lights which flash, so those are our alarm settings. If we have a red alarm, that is a high priority alarm and should be responded to very quickly. It may be that the patient is in asystole, so we need to respond to that immediately. And then it goes down to our low priority alarm, which is a blue alarm, and that may be that you pause the blood pressure cuff for a moment or two, or that one of your leads has fallen off. It says on the top left hand corner where we are based, so we know which cubicle we're in, and that will be attached to the central monitoring. At the top here we have a patient which is non-admitted, so we recommend that all your patients have their demographics admitted onto the screen. It can be done either by pressing at the top there, and it'll drop down the box to enter the demographics, and then we can just open that up and then enter all the patient's details. The other way we can do it is there's a button on this bottom here. These are smart keys, and again if we press the patient demographics it will bring up the same box, so we can alter it that way as well. That needs to be done for all your patients. Then it has a date and the time, and then it says that we have an adult patient, which we do have at the moment. If we wanted to alter that, we can press on there and we can alter it to the age limit for the particular patient we've got. So if you've got a paediatric patient in, then we're going to get the correct parameters set for you. Then in this top right hand corner it says standard at the moment, so that's how we view our screen. We can change it to big numerics if we would like, so we're just viewing the screen in a different way. If we want to go back to our standard screen, we can just press on here again, or if you wanted to record an ECG it can be done this way as well. So our patient's already got the monitoring on and he's got a 12 lead set up, so we can then press capture 12 lead, get our waves coming onto the screen. When that's all complete we can capture the waves. So our ECG looks like this, and then we can print it by pressing that button there. So after you've done the 12 lead ECG and I want to get back to the standard screen, I can press standard there and it reverts back to the original screen. So the green line at the top there is showing our heart rate at the moment, and that's showing 75. Obviously we get a lot of patients who have abnormal readings and they might be alarming all the time because they're set outside the parameters which are on the machine. You need to discuss that with your clinician and you can alter the parameters so it's not alarming constantly, and that can be done by pressing there. We have a high limit and a low limit, so if we wanted to alter the high limit we can go up and down and set whichever limit we want to go to. And the same can be done for the low limit by using that button there. That must be discussed with the clinician. The other thing I'd like to show you is on the heart rate there, if we wanted to look at a different lead, so it is set to be on primary lead 2, but if the doctor wanted that changing we can change the machine to a different lead on there, so that's now set on primary lead 1. This one here is our SpO2 and that's attached to the patient already. Again we can alter those limits, but that needs to be discussed with the clinician. Our respiratory rate is shown by the blue line here. It can be sometimes a little bit inaccurate due to leads falling off. It requires all the leads to be on the patient, but also if the patient's got a lot of movement as well, it's not always accurate, so we do recommend you do a manual respiratory rate count. In the bottom left here we have the blood pressure, and again we can alter the alarm limits on that by using the screen here. There is a timer on the bottom right hand side, but again we don't need to use that because we've got a separate timer in the room. The bottom left here is a silence button, so if it is alarming we need to silence it, but we do need to respond to that alarm, find out why it's alarming and then act on that. The stop button here, that's for recording our blood pressure, so we can press that on there and it's going to record on the patient now. We can set repeat time. The machine, when it's switched off, will default back to 15 minutes, but if we want to alter those to 5 minutes, for instance, we can do it by using that button there. So it's going to cycle up every 5 minutes now. Again, the smart keys, I've shown you the patient demographics already, so there's various ways you can alter your machine. The 0 there, that is for if we had an arterial line or a CVP line, we need to 0 it. That's how we do that. The Vital Trends is a really useful tool. Sometimes our patients are not in the emergency room for very long, and we may not have managed to record all their observations down, but we can use a Vital Trend. We'll get all our observations recorded on there, and then we can print that record off, and that can then go with the patient. Change screen again, we press that, it just takes us back to doing a 12 lead ECG or big numerics. We recommend that you end the case, obviously after all patients, so get the correct patient's details in there, and that can be done by using this button here. We press the arrow, it just brings up a few more options for us, so we can change the alarm limits, alarm volume, and the brightness, for instance, on the machine there. Okay, so this just demonstrates what the red alarm sounds like. It's flashing up at the top here, and it's telling us a cause of the alarm, which is now saying extreme tachycardia. If that's not responded to, it will get louder, and it does get faster until somebody switches it off. Okay, so we now have a yellow alarm, and at the top here it's just telling us that the blood pressure is low, which it is. So we've got a light flashing at the top here, and also the reason for it just showing there. So at the top here we have a blue alarm which is flashing, and that just says that the C3 bleed has fallen off. Okay, so it's a low priority alarm. Okay, when the patient has been discharged, if we end the case here, it asks you to confirm that you're ending that case, which I'm going to do, and then it puts it back into standby. And when we're in the emergency room in particular, it's good to leave it in standby, so when you get your next patient in, it doesn't take so long for the machine to come back on.
And so that's how we recommend using the Philips monitoring system in this department. Go for your patient's monitoring with the ABC approach, and remember to always discuss any changes in parameters with the responsible clinician.